Hey guys, welcome back to CNA. It's time to do TAR G. That's going to be your infection TAR. It's going to be from chapter 5 in the 3rd edition of your textbook. And if it comes to something that you need to know straight from the book that you don't have your book for, I'm going to read it aloud for you. Okay, so for some of you guys, this may be a review. For others, it may be new material. Either way, even if it is a review, I might mention something that I didn't mention before. And it's always good to have a refresher, especially if you're getting close to being finished. That way that you will have it fresh on your mind when you go take your state board exam for your certification. So here's our quote: with your head full of brains and your shoes on your feet, you're too smart to go down any not so good street. Just keep that in mind when you get out working in the real world. There will be times where people will say, well, that's not how we really do it. Well, you're trained and you're accountable for your own actions, not the actions of that person that says, well, that's not how it's done in the real world. So even though they may be comfortable taking corners, I would not advise you to start taking corners. I would start out my career with my goals and your personal achievements that you want to do. Be the person that you would want taking care of you. Don't be the person that you would say, oh my God, I can't believe they're in healthcare. So just strive for that. Don't go down those not so good streets. Take care of yourself, take care of the others, and do your best at everything you do. So growth in microorganisms, this is from pages 57 through 58. The MO, or microorganism, would be a tiny living thing that's only visible under a microscope. You need to be able to recognize the signs and symptoms of infection that will be caused by that little microorganism. Infections occur when pathogens invade the body and multiply. So pathogens are basically bad microorganisms in this lecture. They may not always be considered bad, but for now, pathogen equals bad microbe. So two types of infections, it's going to be systemic or localized. Either one of those can be a healthcare associated infection, which used to be called a nosocomial infection, and you may still hear it called that when you're out working in the real world. Now, you can tell the difference in the two because a localized infection will be just that. It will be local to a certain area, to a certain place of the body. An example would be an ingrown hair that has pus around it, or a pimple or a cut that might have gotten a staph infection in it. All of that is localized. Now, systemic infections are different because they infect the whole system, the whole body system overall, not just one particular system. In other words, it would be like that strep throat that started out localized only in the throat, but now it's in the bloodstream. Now it's affecting the heart and the kidneys and the liver and everything else in the body. That is now a systemic infection. So it can change. It may start out localized and then end up being systemic, and that's important to know. So signs and symptoms of the two to help you differentiate. A localized infection will have pain, redness, swelling, pus, drainage, or heat. A systemic infection, the patient will have fever and chills. They might have body aches, nausea and vomiting, weakness, headache, confusion, a drop in their blood pressure. And we're not talking about a little bit of a drop. We're talking about a major change. Increase in heart rate and change of temperature in severe cases. Now, if you are taking care of your patient and you know that they have a systemic infection because it's in their chart, and you go in to take their vital signs, and all of a sudden their heart rate jumps up to 160. First of all, that's not normal and should be reported anyway. But if you know that they have a systemic infection and you see that, I would strongly advise you to immediately get some help because that patient is about to probably go into shock. Infection can cause shock in your patient. So just know that if you see a drop in blood pressure or an increase in heart rate, a change of temperature, all of that is part of the severe systemic infection. You're going to see all the other stuff first, the fever, the body aches, the nausea, vomiting, weakness, headache, confusion. You're going to see all that at the beginning. But when it gets severe, you're going to see changes in vital signs, and that's when it starts to get really dangerous. So the chain of infection, you have your infectious agents, which are your germs. You can see them at the top. I know this picture is a little blurry, but I mainly wanted the pictures for you guys. Those of you that are visual learners, it may help. Then you have your reservoir. That's me, that's you, that's a bug, that's a stethoscope, it's a dog, it's a cat, it's wherever that germ can grow and multiply. Kind of like it's storage. Think of it like storage. You have a water reservoir, it stores your water. Well, you have a germ reservoir now. It's going to store all those little microbes. Next, you have your portal of entry. That's where it's going to get into the person, the animal, the whatever is going to carry this little germ. This is where it's going to get into it. It's going to be through your eyes, your nose, your mouth, a cut in the skin, anything that allows that little pathogen, that little microbe to get into your body is the portal of entry. Then you're going to have your mode of transmission. Is it airborne? Is it through contact? Is it through droplets? How is it spread? That is what the mode of transmission means. Then you have your portal of exit. How does it get out of the body? That's going to be your body fluid. It's going to be blood. It's going to be sputum. It's going to be urine, poop, vomit, anything that carries any microbe out of the body is considered a portal of exit. So when you think about that, your portal of entry is almost the same as your portal of exit, except with your portal of exit, you've got that little bit of a carrier, such as the body fluid. Now, then you have a susceptible host. Guys, not everybody is susceptible to everything. Have you ever heard the term immunity? If you're immune to something, you're not susceptible to it. So if you have a chickenpox vaccine, you're immune to chickenpox, you cannot get the chickenpox because you are not susceptible to it. However, somebody that has not had the vaccine and that has never had the chickenpox, they are susceptible to getting that type of infection. Another example would be, we can get the bird flu. We're susceptible to getting the flu from birds. Cats may not be. I don't know if they are or not. I'm not a veterinarian, but they may not be susceptible to getting the flu from a bird. So you have to think about, okay, is it something that I can give somebody, or is it something that they're immune to when you're talking about chains of infections? Okay, so how do they spread? Most infections can be blocked by proper infection prevention practices such as cleaning and washing your hands. Transmission can occur through indirect or direct contact. Direct contact would be like you shook somebody's hand. Indirect contact would be if I touched a doorknob and then somebody come behind me and touched that same doorknob without it being cleaned in between. So a healthcare associated infection, the primary route is on the hands of healthcare workers. It's on the hands of healthcare workers. Healthcare workers are you, they're me, everybody that takes care of that patient while they are sick or while they're in the nursing home, at home with home health, whatever their means of needing that treatment is. So MRSA often manifests as skin infections. Direct physical contact is the most common, but it can spread indirectly as well. MRSA is methicillin-resistant Staphylococcus aureus. That's a mouthful. If you just say MRSA, we'll know what you're talking about, but just know that it is staph, and it's most commonly spread through direct contact. That means people are not washing their hands like they should be. It can spread indirectly as well. So remember, I don't know if everybody were present when we talked about this before, but an example would be if you got a patient and they had MRSA and they were on contact precaution, then you did not wear the gown like you were supposed to. And you went in, they had a cut on their leg and it has oozed on their bed sheets, but you didn't see it because it's just a tiny little spot. They wanted their bed covered up. So you cover up their sheets for them, and now the sheets has brushed against your scrub. You go on to see your next patient. You've cleaned your hands because you think that's all you needed to do. And you walk to the next room, and that patient says, I need some help to the bathroom. So you help them to the restroom, and they nearly fall, but they don't. But they grab you for support. Well, they've touched your scrub. where that you had that MRSA. And then now they're going to the bathroom. They've just had surgery and they touch their dressing because, oh my gosh, it hurts while they're on their way there. Now that dressing has MRSA on it that you've brought them because you did not use your proper precautions that you should have. That's why that PPE is really important. That is an example of indirect contact. So now VRE is vancomycin-resistant enterococcus. It spreads through direct and indirect contact about the same. Tuberculosis is TB. It spreads through mucus in the air. You can have latent TB, which is not active, or you can have active TB. That's the ones that you're going to need to wear a mask in. They're probably going to have negative pressure room. There's a lot of precautions that go into that. And you will know exactly what kind of precautions you need for each patient because it'll be in the chart and it should be posted on their door as well. So what about C. diff? This is going to be page 77. I'm going to read that aloud for you. Clostridium difficile, commonly known as C. diff, is a spore-forming bacteria which can be part of the normal intestinal flora. When the normal intestinal flora is altered, C. diff can flourish in the intestinal tract. It produces toxins that cause a watery diarrhea. Enemas, nasogastric tubes, and GI tract surgery increase the risk of developing the disease. The elderly are also at a higher risk for the infection. Antibiotics cause an increase of that risk as well. When released into the environment, C. difficile can form a spore that makes it very difficult to kill. These spores can be carried on the hands of people who have direct contact with infected residents or with environmental surfaces contaminated with C. diff. Touching an object contaminated with C. diff can transmit the disease. Alcohol-based hand sanitizers are not considered effective on C. diff. Let me say that one more time. Alcohol-based hand sanitizers are not effective against C. diff. So now you've got this little bacteria that lives in a shell until it gets a good condition to grow. And your alcohol, which is Germ-X, let me just point that out, alcohol-based hand sanitizers would be like Germ-X, any type of hand sanitizer, Purell, all of that may be based on alcohol. And I don't know which ones are and which ones not. I'm just using those as examples. All of them that are based on alcohol may be effective on other things in producing a less chance of infection. But when it comes to C. diff, they're not effective because of that little spore. The only way to protect against C. diff is soap and water. You use it on each time when you perform your hand hygiene. So basically, if you think of C. diff, think of it like an acorn. It's got that hard little shell around it, and it can last all winter in really harsh conditions. But then come spring, when it's favorable for it to grow, it cracks open its little shell and it grows. C. diff does the same thing. It can stay on that surface for days, for hours, for whatever it needs to do until it's got a nice little environment that it can grow again, your body. And then it's going to hatch open and it's going to grow. That's what it means when it says spore forming. So symptoms of C. diff include frequent foul-smelling, watery diarrheas. It's a smell like no other. That's one of those senses that we'll talk about later in a different TAR. Use your smell when you're observing your patients. And it can also cause blood and mucus to be in the stool, nausea, lack of appetite, and abdominal cramp. If you have to take a stool sample, make sure that you're using the proper guess you would say proper procedure, struggling to find the right word here, for gathering that sample. You don't want to contaminate yourself, and you don't want to contaminate anybody else. So if you have to take a stool sample, and you will, if you're the one that gets the patient that day that they decide, oh, they've got C. diff, because that's how we determine whether or not it's a C. diff infection, is with a stool sample. You need to make sure that you understand how to get rid of the contaminated waste and how to properly bag it so that when it goes to the lab, it's not infecting everything on its way down there. And make sure you're cleaning your surfaces with bleach or a different appropriate disinfectant.